Let's Cover That podcast is brought to you by CM&F Group, professional liability services for over 200 healthcare professions. Visit our website at cmfgroup.com/podcast for more info.
Hey everyone, it's another episode of Let's Cover That with Will Sullivan, my co-host.
Antonina Agruza. And today we have with us Dr. Joshua Emdur, Chief Medical Officer at SteadyMD. Dr. Emdur, it's a pleasure to have you on the show today.
Yeah, guys. Yeah, thanks for having me. Always excited to talk all things healthcare, digital health, and care innovation. So I love what you guys are doing, and thanks for the opportunity.
Of course. Dr. Emdur, can you tell us a little bit about your background in healthcare, how you made your way into the industry?
Yeah, thanks for asking. So for me, I'm actually the son of a physician. I grew up the son of a pulmonologist who was in private practice for he's still in private practice after 40 years. So I kind of grew up around the business of medicine and patient care. And, you know, I kind of view myself as very fortunate in that from an early age, I just kind of knew I wanted to go into medicine. It just really just kind of watching my dad, kind of have this ability to help others and also do really interesting work was always just really appealing to me. So for me, I love the mountains. I grew up in Southern California, but ended up out in Colorado for undergrad, where I worked real hard. And then from there, went to medical school in Pomona and chose to be an osteopathic physician because I really identified with the tenets of osteopathy. And from there, did a residency in family medicine, and finished my training back in 2007 at a time where healthcare was really changing. We had just seen managed care in California and the rise of Kaiser, and the writing was really on the wall at that time that it was not the right time to start your own practice. And for me, kind of growing up watching my dad, kind of build his practice, take great care of his patients. I didn't really have that opportunity just with the way that reimbursement was. So I chose to take a job, move back out to Colorado as a hospitalist, working at my local hospital, where I did shift work, taking care of patients from the emergency room on, and did that for 10 years. And it was really a great opportunity, was able to kind of refine my craft and learn a ton about taking care of really sick patients in the hospital. But also during that time, I realized that there's definitely a better way to take care of people. As we all know, the emergency rooms end up being kind of the de facto front door to healthcare for a lot of patients who don't have any other access. So for me, I was seeing a lot of patients who would show up in the ER, maybe in their mid-40s, after having their first heart attack, which could have been prevented if they had access to care earlier and, management of their undiagnosed diabetes or other risk factors that the patients simply didn't know that they had until they came to the hospital with a problem. So that was, like I said, I did that for 10 years in hospital medicine, and I wouldn't say that I burned out, but I knew that I needed a different challenge, and I knew, like I said, that there was probably a better way to care for people. And just as the world would have it, right in 2017, a startup called SteadyMD reached out to me when they were looking for a primary care doctor who runs marathons to launch an online concierge practice for serious runners. And I was like, sign me up. This sounds great. Give me an opportunity to kind of do what my dad did, build a practice, take care of patients in a new way that can work really well for both the patients and the doctors and build something new. So partnered with SteadyMD in 2017, and 5 years later, I'm still here with the company. I'm a chief medical officer and would love to kind of tell you a little bit more about that journey if that's something you guys want to hear.
So interestingly enough, so you're still here at SteadyMD, but how's your marathoning going? If you're out in Colorado, I have to ask: are you competitive with your own patients or with the clients that you guys work with? Is there competitive streak on that?
Fair question. With COVID, it really did change my life in a number of ways. One of those, I really kind of lost the motivation to be around lots of people. And I mean, that's what I love about the marathon. I mean, I love going to New York or Boston and, just being like really immersed in humanity, like running with, tens of thousands of other people who've trained and are super passionate about something. So, I've trained just enough to like kind of keep the wheels on. I actually went out for a 6 mile run this morning, out here in California, it was really kind of every day I get to run is really a blessing. Like it's hard to do, but like once you get going, it's great. And just being able to have like a common interest with your patients, especially like over digital health, is such a great way to build rapport. So it was really the we call it our consumer practice at SteadyMD. It's now powered by Lemonade. So SteadyMD has moved into a place where we power telehealth for other healthcare companies. So I still take care of my marathoners, and it's probably one of my favorite parts of my job. Like as chief medical officer, a lot of my work now is kind of administrative, but being able to connect with my patients with similar interests is just it's so great on a lot of different levels.
Yeah, so it really, it's interesting, kind of noting the marathoning and how you get that distinct connection to your patients, your clients, however, everybody frames them in each profession. But it's interesting that you take that crux of like a direct personal connection and then you kind of scale it out through this telehealth practice and the clinicians nationally. So kind of, and all the while, I would imagine with all the clinicians you guys have nationally, if you can kind of give us a breakdown of what that looks like, it's got to help ease that burden of, being burnt out or just needing to change or where you are in your stage of life and the offering that you have at SteadyMD. So kind of give us a base understanding of what SteadyMD is doing. You're working with Lemonade, providing that telehealth platform capability. What does that look like? Organizationally, but then these clinicians, whether it's nurse practitioners, mental health providers, hopping on with you, physicians.
Sure. So, at SteadyMD, we started in 2016 with this kind of beautiful model of matching patients with doctors. I think to this day, we're really the only digital health company that I know who has kind of done something like this. We had a marathon practice, a CrossFit practice, and really did something cool. And in 2020, with COVID, we did a bit of a pivot, and that was to power telehealth in all 50 states for other companies. And the way we've been able to do that is, number one, we, like I said, we partner with a lot of different companies, so we have a lot of varied work. And we have a 50-state workforce of doctors, nurse practitioners, and therapists. And what's been really valuable with what we learned during those early days of SteadyMD with the direct-to-consumer world is we really learned what it took to have the medical operations and oversight that's required to power telehealth. We have end-to-end product and technology offerings. So a company can come to us and we can really use our expertise and our product and our technology to make it happen. We handle the credentialing, licensing, and payer enrollments, which is something that I think we should talk about at some point today. And then we take care of all the legal work for like the legal and regulatory work that's required to practice in all 50 states, which is really, it's a lot. A lot of people think naively. One thing that always sticks in my head, going back to 2017 after being in the hospital for 10 years and being part of my local medical community, like some of my colleagues were like, Josh, so let me get this straight. You're leaving this great job here for this, really, really amazing community-owned healthcare system to be an internet doctor. And that's a question that I had to answer. And people didn't really, my colleagues didn't respect it at the time, but going fast forward 5 years, like they realize that there is real value in it. And it's not just like this, being an internet doctor and like there's no process, there's no legal review. I mean, at SteadyMD, we're really on the forefront of really building the credibility and building the process, building the QA to make sure that patients are getting great care at scale. And for me, like I've worked in the hospital, I've also worked in the clinic. A busy day of seeing patients in person is like maybe 20 encounters a day, sometimes like 30 if you're doing like urgent care type work. Um, and those days are busy and hard and I mean really important. But what I've learned in my career in digital health is by using technology, by using process, using different visit type modalities, whether it be async visits where patients are filling out an intake that's then being reviewed, and then a synchronous component as needed. I mean, you can start but you can start offering care to hundreds of patients a day in a way that doesn't burn people out, like the 30 patients a day in clinic.
Right. And to your point earlier about, your friends asking, so you're just going to become a virtual doctor. There's been some
Internet
reports
doctor.
about
Internet doctor.
I'm sorry, an internet doctor.
Yeah, we're going back to 2000 almost. It feels like, Y2K, and you're an
Exactly.
internet doctor. So virtual.
But there have been some reports comparing virtual care to being an Uber driver. How do you feel about that?
Yeah, so I think in the early days being like a couple of years ago, like I think there was like the signal that you could like offer clinicians like a side hustle, if you will. But what we've seen with Uber and ride sharing companies is a churn rate of like 90. Like I've seen the statistic of 97% of Uber drivers quit within the first year. And with healthcare, we have a clinician shortage. Like we don't have a huge pool of qualified applicants, so we can't just churn through our medical professionals. So it's my job as the chief medical officer at SteadyMD to not burn out my clinicians, but to really offer them a career that they have earned by working their tails off in school, jumping through the hoops, doing well on their exams, getting through residency. Same thing for nurse practitioners, working in the field, going to school, getting training. But really at the end, making sure that we are offering them a career where they are enjoying their lives and they're not burning out, and at the end of the day, they're able to take good care of themselves so they can take great care of their patients. I firmly believe that as a caregiver, or really anyone who has a career that directly relates to other human beings, like you can't be effective at your job if you're not in a good place personally. So I have a big task of like, how do I come up with a system that really works, where it works for the doctors, it works for the nurse practitioners, it works for the patients, and also the therapists. At SteadyMD, we do have a team of therapists as well.
Yeah.
So I think it's just like a super exciting time in healthcare. Like getting back to that comment of my colleague saying, "Oh, Josh, good luck being an internet doctor." Or, I also got a comment of, "Oh, must be nice that your wife's a surgeon," which she is. My whole family's in healthcare. But
Sure
now we're at a
nice.
point where, yeah. But yeah, I love my wife. She's great. Hopefully she'll listen to this podcast. But I think we're at a point now where digital health has gained credibility, and it's at a point where, in the early age of like the Uber driver kind of model of bringing in doctors for like a side gig to say do real transactional care, whether it be urgent care or prescriptions for lifestyle medicines. It was rather simple, and a lot of times it was just direct to consumer cash pay. but this next stage of telehealth is really making digital health the front door to the healthcare system. So this next phase, I think all of our incumbents in healthcare, all of our big systems, they've realized that in order for them to be competitive in the market, they need to offer great digital experience for their patients, so they can stay relevant. So I think that's where we are now. Of like, how do we adapt what we've learned in the consumer digital health industry, and how do we apply that to the fee-for-service model, or the call it the care that's paid by insurers. So I think that's where we're at now. And in order to do that, it's complicated, and we need clinicians who are trained in the process of like using maybe a specific EMR for one healthcare system, getting those patients where they need to go for the right care at the right time and at the right place. And all of that training doesn't really fit the Uber model. Like, it really requires someone who's dedicated and has dedicated to really being a virtualist as a career. Like, just as I was a hospitalist, as things become more and more complicated, it's really gonna, I think there's an opportunity for it to become its own specialty and career.
Yeah, it's really interesting. And another, just kind of question to pose is, you just hear so much about people wanting to pay for this out of pocket, whether it's, therapy, or just, I just need somebody to look at my kid and just tell me they're okay, quickly. I don't want to wait in line where it's hard to get booking an appointment done for my doctor, and all these issues. And people are willing to pay for it out of pocket. When you look at the virtual care capability, virtual first, that you do with SteadyMD, do you see the payers, the insurance companies, wanting to get on the front end of this and supporting it with the reimbursements? Because that's one of the things, I mean, even from personal experience, it's just a misalignment there. It seems like on some services you do virtually, and trying to get buy-in there. Do you find that you guys are kind of the really the preceptor and like pushing this forward and getting the buy-in, or are we there yet?
Yeah, William, I mean,
lagging?
absolutely. Like, we started powering a lot of the small direct-to-consumer startups. And as we've gained momentum, our clients are much larger incumbents in healthcare who are looking to offer digital health to their patients. And the fact that people have to pay out of pocket when they have insurance is really a testament to a system that has too much friction. Like, again, as a primary care doc, I want patients to be able to get medical advice from a professional and not have to just go to Google or wait so long that they're coming into the emergency room after it's too late. So this is the opportunity of, like, how do we make it easier for patients to get the care that they need? Not just the care that they need, but also medical care is complicated. Like, telehealth has a lot of limitations. Like, if someone needs a surgery, like, I can't help them through a video visit, but I can, in the ideal world, I can definitely get them to where they need to go so they can get that surgery when they need it. And we really have this amazing tool to help triage patients and give them really the information they need. And then from there, information is power, but have that first touch be digital, and then get them into the system so they can, in the ideal world, if I were to see a patient with abdominal pain and fever, and during my encounter, I was able to elicit some pain in the right lower side of their abdomen. Like, if I could just put in the order for a CAT scan, they could skip the ER, they could go straight to triage, make sure that they're stable, get the CAT scan that they need, let them know to not eat anything like before they go for the CAT scan. And then from there, they could go like, to pre-op and get the surgery they need at the place that has the ability to do that. And as hospitals are busy, like it might not be the hospital down the street, it might be the one across town, but like being able to be that triage system and air traffic controller to make it so the whole system works better and at the end of the day save costs and improve outcomes is really the goal here.
Yeah, amazing.
So I think like the future is bright. I typically mentor fourth year medical students, and one thing that I've been working with them on is they'll come to me for a telehealth rotation. I'm really trying to get away from that name of telehealth and really explain that this is modern healthcare. Like this is we have all of these tools, and how do we adapt them to just make the system better for everyone? And better again is great experience, good outcomes, and also lower costs, because with the percentage of GDP that our country spends on healthcare, like in order for us to stay competitive, we really have to get a handle of that.
Absolutely. Well, Dr. Emdur, it's been a pleasure getting to know you and SteadyMD, and we can't wait to hear more from you on another episode when you guys have some new announcements to make. But for now, we have to wrap up. Thank you so much for your time today. And this has been another wonderful episode of Let's Cover That.
Thank you, Doctor.
Well, thanks so much, guys.